Hey Foot Geeks fans, I'm here with Kody Au from Baseline Health and Wellness, and today we want to talk about the infamous topic, plantar fasciitis.
Alright, so thanks for having me. So plantar fasciitis is basically irritation at what we call the medial calcaneoturbical, which is right under the heel and usually on the inside portion. And so we'll talk a little bit about what it is and some of the causes as well. So what it is basically irritation on the bottom of your foot that's usually caused by overuse, straining of that what we call the connective tissue down there, and it's causing irritation and pain, usually first thing in the morning when you take your first steps, or after sitting for a prolonged time, maybe 15-20 minutes, half an hour, and then you stand up, and that type of pulling that you get at the bottom of your foot.
Awesome. Yeah, no, that's kind of how I would describe it myself.
Yeah, perfect.
But anyway, what are some of the common treatments that you use in your chiropractic practice to treat that?
So it depends on the case of plantar fasciitis. Oftentimes I think of plantar fasciitis as more of an overuse of that area, because the plantar fascia is usually for springing forward and creating a bit of that lift for you, connecting all the way to your calf muscles and then all the way up. So when you're splaying and taking down forces, it's oftentimes the plantar fascia is taking on the function of other jobs, and that's why it's getting irritated. So my job is to look all the way through the whole chain of the leg to see what could be the problem. Sometimes when we're looking at it, it could be your foot, different areas of the foot aren't moving well, so then we're manipulating, getting some of the joints moving that aren't moving well. Sometimes it's stabilizing, so say the knee is collapsing in, as well as your pronation that I'm sure CJ talks about a lot. And then also sometimes it's just hip stabilization. You're not moving, you're not creating that holding of the glutes and everything that's supposed to keep everything in a proper, lack of a better term, alignment, just proper function in terms of what it's working. And so sometimes that'll irritate the plantar fascia as well.
Okay. What about tight calf muscles?
Tight calf muscles will reflect in a lot of different cases, I think. So oftentimes we'll get plantar fasciitis that comes with it. Some people will get Achilles tendonitis that comes, and then some just get general foot pain and lack of ability to actually push off. So it adds into a lot of different pieces. So long story short, yes, calf can be tight and can create this as well.
All right. So I mean, pretty much what Dr. Kody is saying is that we're looking at the entire body as a whole, and not just kind of a singular piece where you're just looking at the foot necessarily, but you want to see, okay, what else is there up the kinetic chain that may be potentially causing some stress.
Exactly.
So, I mean, one of the things, obviously there's a few things with regards to plantar fasciitis, difference between a high arched foot and let's say a low arched foot. You know, somebody that pronates a lot, or somebody that really doesn't pronate much, maybe supinates more, walks more on the outside as opposed to the inside of the foot. Is there different ways of treating either one of those conditions?
Yes. So in terms of my view, oftentimes the overpronators, which is more common typically, because they're collapsing through, oftentimes I find that it is that the plantar fascia is just stretched out. It's so lax in the foot that you're kind of collapsing through, rolling in. Oftentimes those are the cases that we actually have to teach exercises to bring those arches back up. So sometimes we'll talk about, and there's some videos following with exercises with short foot exercises, reteaching some of those, as well as oftentimes if the feet are collapsing, then the knees are collapsing and other muscles up chain aren't working well, so we're reteaching those muscles to activate as well, to kind of give you that arch and to take down some of that compressive force as you're kind of falling through into pronation.
Okay.
For the high arch plantar fasciitis, those are kind of the opposite spectrum. They're not moving very well, so it's kind of like a stiff board hitting the ground. So then the bottom of the plantar fascia there is just taking all the beating. Instead of being overstretched, it's just kind of like locked in there because nothing else can move, and it's the only thing that can take the beating and in terms of what's going on.
Right.
So in terms of that, the supination, that foot is really high, and as a result, oftentimes we're teaching them more mobility drills in both the ankle joint, what we call talocrural, so the top of the foot, as well as all the other joints in the foot, so that you can get a bit more motion and creating some of those. In addition, sometimes we also see with those cases that it irritates the nerve on the inside of the leg.
Okay.
And so as a result, we actually have to desensitize that nerve, or else the pain actually doesn't go away. So that's another case that comes on.
So it could be nerve pain that's causing the feeling of discomfort in the arch?
Yes. So in terms of that, it's a very specific nerve. It's called a saphenous nerve. So that nerve is actually fully just skin-based. And so it travels, it comes out of the inner thigh, and it comes down and supplies the skin sensation all on the inside of the leg. And it actually ends right at that medial calcaneal tubercle.
Yeah.
And so as a result, that kind of pattern that they get, sometimes it'll mask itself as a shin splint.
Yeah.
Sometimes it'll mask itself as a plantar fasciitis. And those are the cases that are challenging, because oftentimes you've tried so many different things,
yeah,
and you just don't know why nothing's happening.
Nothing is working, yeah. There we go. So if that may be something that's been chronic for a while, there's another potential solution that we may have to address.
For sure.
Now, if you have any questions regarding any of the topics in this video, please post your comments and questions below. And if you haven't subscribed to us yet on YouTube, do so right over that way.
So here, and here, keeping, and these are settled. And so here.
Basically pulling on the heel bone and then tugging on the toes at the same time.
Pulling that apart and then compressing it.
And
so you're just
compressing
stretching it out. And then you're going to do a rotation. So
you rotate the heel medially laterally, kind of thing.
Opposite.
And
So
opposite from the forefoot.
Yep. And you can do flexion of the toes, extension of the toes. As well. Good. And then you can squeeze your toes in.
Squeeze your toes against the fingers.
Yep.